Welcome to the Wellness and Wahala Podcast. This is a podcast for wellness and Wahala warriors who are a winner, world changer, wise, and winsome. They are dedicated to tackling Wahala, which means issues and problems in Nigerian Pidgin for the good of humanity. Our tribe of subject matter experts in our village are a voice to the voiceless. Like you know, the African proverb, it says it takes a village. So we have a tribe of supporters that we will be interviewing on our show. Oya, join me, the former diplomat and public health advisor, Dr. Tomi Ademokun, better known as Omo Oba, as I give you the best public health and wellness and Wahala gist with wonderful people and guests, my VIPs, using their compassion to take action to put us on a pathway to a Wahala-free life. Bless up. Hi everyone, it's your girl, Dr. Tomi, better known as Ama Abba, and it's been a while, but I'm back again, and this month of May, we are going to focus on Mental Health Awareness Month. Also, in my normal day-to-day job, I support the Native Hawaiian and U.S. Pacific Island region. So this is also the month of May that also is National Native Hawaiian, Asian American, and the U.S. Pacific Island Heritage Month. And the U.S. Pacific Island includes American Samoa and CNMI and Commonwealth of Northern Mariana Islands, Republic of Marshall Islands, Republic of Palau, and so forth. So it is a pleasure serving that region. We call it Region 9 for about 2 years now. But mental health is affecting all of us, frontline workers, public health workers, and across various regions in the world, not just domestically, but globally. So I just want to start off with some facts. Let me drop some facts for y'all. Each year, millions of Americans face the reality of living with a mental illness. During May, I want y'all to join Wellness and Wahala Podcast as we raise awareness on mental health issues. I will also give you some gems of wisdom and some tips on how to overcome some mental health issues like anxiety and depression and stress and so forth. Because, there's a lot of stigma, especially in our community, an African community and minority community. But as a Nigerian American, they like to sweep mental health issues under the carpet and put a lot of stigma to it. Like, that person, they are my person. No, everybody gets mad at times. Everybody gets some type of anxiety and mental health stress. Wahala, they finish for any of our lives, both personally and professionally. And we need to be able to provide support to each other and be transparent and educate the public and advocate for policies that support people with mental illnesses and their families. And the theme for this year, 2022 Mental Health Awareness Month, is Together for Mental Health. Mental health is an incredibly important, vital part of our overall health. With a growing number of Americans and people just globally experience mental health symptoms, we need to join together to advocate for improving our nation's mental health care systems. There's been increased suicide, people breaking down, and especially when you have to quarantine and be in isolation due to this COVID-19 Wahala pandemic that we've been battling for 2 years. And this past week in the U.S., it marked 1 million people dying. That's the mortality rate of COVID-19. And that's a lot. And that's more, of course, when you look at the other regions across the world. It's just 1 million in the U.S. So we need to join hands and, tackle these issues in regards to mental health. That's here in the U.S. Then let me drop some facts for you for the Africa region. So 4 facts you might not know about mental health in Africa. And this is coming from my resource is World Economic Forum. And, we need to be able to demand for mental health services and resources for everybody. And even if you can't afford to go to counseling, there's other resources. Like I have mental health cards and journals, and my best one is Bibeli Mimo, the Bible app, YouVersion. It has a lot of Bible study plans on mental health, on depression, on anxiety. If you're going through divorce, broken relationship, wahala at school, whatever. There's nothing new under the sun that no day inside the Bible. So that's also another good resource. That's one of my personal gems and tips. The Bible will never, ever doubt you. But of course, it's good to have somebody. So whether it's a spiritual counselor, a pastor, an apostle, somebody in your life that you can go to. And, in Africa region, many people are vulnerable, especially women and children. And most African governments devote less than 1% of their national budget towards mental health services. Also, evidence-based interventions is a frontline method of treating mental illness in low-income countries. However, depression is the most prevalent mental illness in the world. I tell you, a lot of people, they depress, They complain, they nag, there is some of them, but Africa, they like to disclose. We don't like to disclose our suffering. Fela used to say, suffering and smiling. People, they will pack on, especially as women, we will dress up, wear makeup, look hot, but deep down, we're crying, we're depressed. So we need to get down to the basics, okay? Currently, an estimated 100 million people in Africa suffer from clinical depression, including 66 million women. Hear me? 66 million. Okay? An estimated 100 million people in Africa suffer from clinical depression. The World Bank considers it the greatest thief of productive economic life, with yearly global costs for mental, neurological, and substance use disorders and abuse estimated at between $2.5 to $8.5 trillion a year. Because of this depression, wahala, people take it out, drinking alcohol, getting high, doing all types of rubbish. That figure is projected to nearly double by the year 2030. Because this pandemic, I'm telling you, that number just double, quadruple, I'm pretty sure. So when research shows that mental health services provision is being neglected, okay, particularly not just in the U.S., but in developing countries, and, or I would say other regions, not necessarily developing countries, but other regions like Africa, we must learn how to meet this growing need, particularly for the most vulnerable women and children and those that are disabled and elderly, that are very vulnerable. One, more people are in need of mental health services now than ever before. This pandemic has really showed the mental health stresses and the lack of our public health system and our healthcare systems to really sustain all of the mental health issues that are just an outlying effect to this pandemic. And in 93% of the countries at the same time, demand for mental health programs is increasing, according to a new WHO, World Health Organization survey. Over 60% of the 130 countries surveyed reported disruptions to mental health services for vulnerable people, including children and adolescents, older adults, and women. And those are the people that are most vulnerable. They hear me. So, also, there was a survey conducted by Strong Minds in regards to this COVID-19 pandemic and mental health in Africa. And the results suggest that previous exposure to mental health services has had a bolstering, horrible effect on respondents' ability to cope with stressors brought on by the pandemic. This supports the United Nations 2020 policy brief on COVID-19 and the need for action on mental health, which called for increase in global mental health services to help families during this COVID-19 crisis and beyond, not just during this pandemic, but moving forward. We need more resources and support for mental health services, especially towards the more vulnerable communities, people that can afford it. We should have our government try to provide those resources and budget in our national budgets for that type of mental health services. Number 2, depression is a silent epidemic. The majority of African women don't have access to mental health service. In the communities where Strong Minds work, they see depression rates as high as 20-25% in the women that they screen. For African women afflicted at twice the rate of men, depression is the number one cause of disability. Most African governments spend less than 1% of their allocated health budget on mental illness. Due to lack of investments in related services, 85% of the people suffering from depression on the continent have no access to an effective treatment, y'all. And then let me drop some other, statistics. The Lancet Global Health article that is titled Mental Health in Africa states regarding the weaknesses of the continent's mental health services, there are 1.4 mental health workers per 100,000 people. You hear me? 1.4 mental health workers per 100,000. So one person to 100,000. How that gonna work? Compared with the global average of 9 person per 100,000, which is still a problem. The region also performs relatively poorly concerning the number of psychiatrists, the number of hospital beds for patients with mental illness, and the coverage of outpatient facilities. Also, when it comes to, counselors, partly as a consequence, the proportion of Africans who receive treatment for mental health problems is extremely low. Because when it's like 1 to 100,000, the ratio, you already know there's a problem. And there are proven solutions, but they aren't widely used. So there are evidence-based strategies that are available, but they're not widely used, y'all. So once again, before I get into those strategies, some of the good things are like group therapy that might be beneficial to people. However, 1 in 4, people in those communities have access to those type of group therapies. 80% of women treated remain depression-free 6 months after therapy when they do access therapy. And for every one woman who recovers from depression, 4 members of her household feel the benefits. So when, somebody in your household has been able to get treatment for mental health, it is beneficial not only to them, but also to their family, to their spouse, to their children. It's a ripple effect. So as I said, number 3, there are proven solutions, but, our people know they take them up. The WHO endorses group interpersonal psychotherapy as a frontline mental health intervention for vulnerable populations. And groups are led by a facilitator over a period of 12 weeks to help members identify the root cause and triggers of their depression and formulate strategies to overcome them. Since depression is episodic and recurrent throughout most people's lives, these newly acquired skills have both immediate and long-term preventive impacts for the sufferer. It is only organizations scaling the cost-effective solutions to help end the depression epidemic in Africa and really advocating to our African leaders to put more resources into mental health. They're, less than 1% of their health budget goes to it. Since, advocating for mental health and therapy, 90,000 depressed women in Uganda and Zambia started group talk therapy, a pilot in 2014. And over 80% of the women that were treated for depression continue to be depression-free 6 months post-treatment. And the results also showed that for every woman treated for depression, up to 4 members of her family benefited. 16% of women report an increase in work attendance, 13% an increase in family food security, 30% of women say that their children have fewer school absences. So y'all, when you get treated for mental health and you're off, your sleeping habits, like me, I know like when I'm like stressed out and anxiety and, depression might hit, like I'm like, okay, I'm not sleeping well. I'm not eating well. I'll have headaches. I usually don't get headaches. Like your body, the way God made our anatomy and physiology is very good. So it's going to give you signs. You're going to have red flags. You're not going to be operating as normal. You understand? If you know that you're not sleeping well, you're waking up a lot in the middle of the night, you're sweating, having nice sweats, so many different signs that's Wahala Day. We need to be able to address it. Number 4, ignoring mental illness has wide-reaching impacts beyond the individual experiencing it. Look, that is what I'm trying to tell you. Many of our African people and those blacks here in America and just minorities, or actually the global majority. But anyways, that's a conversation for another day. But in the speaking from our community, in the black community, in the African community, most of the time we be hiding and ignoring our mental illness and the signs. And we need to stop. You understand? You're not the first. You're not going to be the last. As, my momsy and my popsy will say, you're not going to be the first. You're not going to be the last. So get over it and address it so you can get better. And when you get better, and you get treatment and you address your triggers and your issues and your wahala, you'll be able to be a better person, not just for yourself, but for your spouse, for your children, for your family, for your community, and, for all the network and people within your network that you are affiliated with. Everybody can benefit. But when you're a hot mess, you got mental health issues, you're depressed, and then you pretending and ignoring those signs, it's a problem. So let me give you some examples. In Uganda and Zambia, we see how women's impaired ability to function in day-by-day life creates profound hardship. When a woman is unable to perform her essential social responsibility, doing a pilot study there, she can become a target of criticism and exclusion. Women were jack of many trades. So not only are we doing our regular job, we might have a business side hustle on the side. We have to take care of our children. We have to perform and take care of our hubby. So many things on our plate. We have to take care of extended family, mothers and fathers, elderly, and so forth. And, you might be involved in your church and this and that. And it's a lot. An African woman with depression compared to her healthy peers suffers greatly. She is less productive, has a lower income, and has poor physical health. So I know when I'm going out of whack because I start gaining weight. I'm not eating right. I am not disciplined in my eating habits of eating healthy, and it's a mess. If she is a mother, the negative impact extends to her entire family. Research shows that children of depressed mothers are more likely to have poor health and struggle in or miss school and suffer from depression themselves, y'all. Additionally, untreated depression symptoms in young people are linked to increased alcohol use, increased sexual behavior, and so many other things. So I know that, because, I can speak firsthand as a mom, and just, being also in a relationship. Like if I'm off, my partner, he's going to feel it. He's also going to be off. He's not going to be happy. And if you're not happy as a parent, and you're depressed and you're having anxiety issues and you're not trying to address it and heal, it also affects them and vice versa. So we really need to be active and at the individual level, take care of ourselves. At the national level, at the political level, advocate to our governments at the local, at the state level, and at the federal level to put more resources to support, especially those that are vulnerable, women and children, to help reduce the impact of depression, both here in the U.S. and globally, and to provide the mental health services that are vital, that are needed in our community. It takes all of us. And so, for example, if you're here in the U.S., one of my tips, is to look at the mental health budget within the health budget and resources that are in your state. And if you're not happy about it, which there's not enough. I can tell you that now. So, in the Africa region, it's like 1 to 100,000, right? Mental health providers. And then here in the U.S. is like, I think 9. So not even up to 10 to 100,000. So we don't even have that much mental health providers. And, those that have access is one thing that, have those providers, but then those that have access and that can actually afford it, that's another issue. So being able to contact rights, now, thank God for technology. You can be able to reach out to your senator, to your House of Rep online, and tell them that you want, you voted them in, that you want more resources, more of the health budget allocated to mental health services, and especially making it accessible and affordable for more women and children and elderly and disabled, and holding our government officials accountable. I call it the 3 A's: accountability, accessibility, and affordability when it comes to mental health services. So once again, happy Mental Health Awareness Month. Take care of yourself. Another tip that I have, one of my great relaxing trips, thanks to Toy and Travel Agency. We went to Dubai, United Arab Emirates, and when I say we turned up. We did a boat tour. We went to the tallest building, the Khalifa. We went to the new museum that they opened up. And the Museum of the Future, they opened up in Dubai. We went to the Dubai Expo. So it was supposed to kick off in 2020, but due to the pandemic, they stopped and they postponed it. And the expo was rounding up this year, so we had to go. And it was so nice because you get to visit like different pavilions of different nations, across the world. And of course, we went to Nigeria, went to the U.S. one. We went to so many. We went to the Egypt one was beautiful. So let me tell y'all. We had a ball. So traveling is also learning, it's relaxing, and it's self-care. You know what I'm saying? Go to the salon, get your hair done. Go to the spa, get a massage. You know what I'm saying? Like when we went up to Dubai, we stayed in a nice hotel at the rooftop. They had an infinity pool. Was able to just go to the pool, put on some nice music, relax. My daughter's a track star, so she was up in the gym. I could see her in the gym from the infinity pool. She was working out, and I was doing my workout in the pool. You know what I'm saying? So my own workout is more relaxing anyways. But I had so much of a great time in Dubai. And of course, my next dream country list to go to is Israel, the Holy Land, Tel Aviv. Take a tour, where Jesus walked, Yeshua, and just, tap into Adonai and Yeshua's history and spirits in the Holy Land of Israel, Jerusalem. So I look forward to that one by God's grace. And just visiting other countries that I have not visited yet. In the past 2 years, early in the pandemic, I'm telling you, flights were so cheap. We were able, and hotel resorts, so we were able to go to like Cancun and Puerto Rico. So once again, thanks to Toy and Travel Agency, I will drop her link in contact. But she is the best. She will get you the best affordable deal. She really goes the extra mile. Even gives you a travel gift package where she'll put, all your tickets and your hotel and, your transport information, your expediter that meets you at the airport, everything that you need. She mixes so good. Like before, when I never had a travel agent, I don't know how I traveled or de-stress, alleviate all of that stress. And having a travel agent is free, y'all. You know what I'm saying? So, traveling is another relaxing way to just step away from your busy life and, just relax, and then revive yourself and then just breathe. Another tip of mine is, Apple, you guys need to give me some endorsement, So anyways, and sponsor me and sponsor the Wahala Podcast. But I am an Apple user, and I also have an Apple iWatch. And I'm able to download apps like my fitness app, and also on the watch, they have ways where, where you can breathe, relax. Like sometimes you just need to just breathe in, breathe out. Like use the tools that you have on. I didn't even know that you had things like that, like breathe and relax. Like, and you just, for like 30 seconds, you just wind down. Breathe in, breathe out, breathe in, breathe out, breathe in, and relax and just clear your mind. Don't think about any rubbish, no wahala. It's good, Or they have this one, relax and reflect. Reflect on the blessings, In Africa and Nigeria, we have one song called Count Your Blessings, Name Them. I can't sing it, but you get the point. Count your blessings, name them one by one. Count your blessings, see what God has done. Count your blessings, name them one by one. And it will surprise you what the Lord has done. So sometimes you just need to just sit back and thank Baba God. That is my last tip of the day, is that, we just need to commit everything to God, and our plan will succeed. When you commit everything to God, everything will go well. You understand? So you might not know how, and it might not go well at that moment, but eventually God will work all things together for our good. Okay, and God knows the plans that He has for us. So that is my Wellness Wahala scripture that I'm leaving you with, Jeremiah 29:11. For I know the plans that I have for you, says the Lord Adonai, plans for good and no evil, to give you an expected end, So you should know that God is the one that created you, and He knows the beginning from the end. So we should be able to commit our plan to God for it to succeed. You understand? And when you commit your plan to God, God will make a way where there's no way. You understand? He will put you in remembrance of His promise. So that's why I said go back into the Word of God. That is one of my favorite tips. And the Bible YouVersion app has a wonderful study guide planned, and they don't even have to be long. And sometimes, I can tell you, so if I have anxiety and I'm just stressed out, I don't even want to read. But thank God for audio. Once again, technology. I will put on the audio version, and I will let the Bible plan and the Bible read to me. You understand? And they have different versions. They have Yoruba. They have, they have different languages. They have English. It would be nice if they have a Nigerian pidgin. So for you guys that are from the Niger Delta region, I want Edo, Rivers, Delta, Warri people that can speak Niger Pidgin. And we do have, I think, a Niger Pidgin Bible. And there's one app that I think it's called, Hearing Comes something by, I could drop that link. But it is basically an app that has a different African languages translated of the Bible, both the New and Old Testament. And they had a Yoruba and they had Nigerian Pidgin. I don't think for the Old Testament, but they had it for the New Testament. So anybody out there that got that skills, holla at me, because I love it. Like when I hear Bibeli Mimo, that's in Yoruba, the Holy Bible, meaning Holy Bible in Yoruba, Bibeli Mimo. I love it because, when you hear the Bible spoken in your dialect, is just something else. So sometimes I just have the Bible just playing to me. And also, there's a lot of great mental health podcasts on Apple Podcasts or Google Podcasts or Anchor. So, you just type in mental health or anxiety or depression, and you have so many resources using technology. So, and I would drop some of those podcasts that I listen to for like Black health, mental health matters, and African mental health issues. It's really, really good. to get those perspectives. And some of them are trained psychiatrists and doctor and mental health counselors and specialists. And it's a podcast and they're giving you tips for free, y'all. So access those things. There's a lot of resources that are free out there. And thank God once again for the use of technology. And, I told you my favorite one, which is the YouVersion Bible Plan. And it has a lot of resources and tips on, if you got anxiety in your marriage, anxiety at work, anxiety just because of this crazy pandemic, everything they did. So, once again, access those resources, and I would drop those links in my profile, and also visit Wellness Wahala Podcast social media pages, my Instagram at Wellness Wahala, and also Facebook Wellness Wahala. It used to be Wahala Wednesday, so that's on Facebook, and Wellness Wahala, Dr. Tomi. That's me, your host, on Twitter. So once again, thank you for tuning in to the Wellness Wahala Podcast, and I wish you love and blessing and a month and a season full of no wahala, and get your mental health right. Peace, love, and blessing. Bless up. Thank you to the sponsor of my Wellness and Wahala podcast, Anchor. It's a great podcasting platform, and also Nido Radio, Nigerians in Diaspora organization, radio 24/7 online radio, which also plays my Wellness and Wahala podcast show. So I'll leave you today with the song of the week. It's from Ada Ehi and Limoblaze, a Christian song that says, "Okay, everything is going to be okay." Bless up.
My God, you're the one for me. You give me good, good loving. Nothing can compare to this. Oh, God, you better see me. Oh, God, you better see me. Oh, God, buy me up, oh, buy me. Buy me up, oh, buy me. Oh, no. I'm alone, let me jet. Oh, you better send us a I'm alone, let me jet. Oh, you better send us a Okay. Your love is more than okay. Someone dead to your love, it's always for sure. Your love is more than okay. Oh, Dara, you better see me. Oh, Dara, you better see me. Oh, Dara, buy me up, oh, buy me. Buy me up, oh, buy me. Oh, no. I'm alone, let me jet. Oh, you better send us a I'm alone, let me jet. Oh, you better send us a
You check me like cha-cha-cha, just to hold me more cha-cha. I feel it so tenderly, I cannot take a la-la. And it's okay, this love is more than okay. Okay, then just a looky. How can I keep it looking? Yeah, the feelings in me all that for me. I never know I want to for you.
Buy me up, oh, buy me up, oh, buy me. I'm alone, let me jet. You better send us a I'm alone, let me jet. You better send us a Okay. Your love is more than okay.